So if your child has cold and cough, please don't send them to school. And we say that even otherwise. For a balanced diet, your plate should be very colorful. What I mean by colorful is like, you have say a pumpkin which is yellow, you have a broccoli which is green, you have a spinach thing which is green, you have a dairy product which is white.
Hi guys, this is Mini Devan and you're watching HealthSite and India.com. Today we have with us Dr. Poonam Sidana, pediatrician, CK Birla Hospital. Hi doctor, how are you?
I'm good, Minnie. How are you?
I'm great doctor, and schools are reopening now. And the situation is not yet stable. There's a lot going around in the country with regards to Omicron, pollution. There's so much, when it comes to kids' health that we certainly aren't sure of, or there are certain areas which still needs, work on. So, do you think that reopening the schools is a good idea at this point of time?
Minnie, these are very tricky questions to answer. You have to strike a balance, right? So kids have been locked inside. I mean, again, the divide in the society. For affluent class, they have enough laptops, they have good internet connection, whereas there are the have-nots who don't have access to this thing. I know of n number of people, kids, from underprivileged classes who are using their phones, which is not a great idea. And they're living in small clustered houses with a lot of, population density. Uh, Again, for the psychological health of the kids, they need to be able to go out, they need to get out of that fear psychosis that pata nahi kya hone wala hai, that kind of thing. So I think it could be a staggered kind of things. There could be something of odd, even like on a certain day certain number of kids go to school so that social distancing can be maintained. We make sure that they are masked, and all those precautions are in place. So we'll have to kind of find that kind of balance somewhere where we do it in a controlled way. We educate the parents, we try and educate the kids as per their age. You don't expect a 4-year old to understand certain things, but a 14-year-old should be able to understand many things. So it has to be a community participation, it has to be a lot of awareness campaigns, education, and in certain ways that okay, we allow say 50% of kids on one day, the other 50% are online, and kind of that sort of thing.
Also with winters, there's a lot of other communicable diseases also that keeps on flowing, flu, um, fever, and then there's Omicron. Sometimes you don't even know how to differentiate a normal fever with that of a COVID, or for that matter Omicron now, because we are not clear of the symptoms. So in such a case, what should the parents do? Is there something that they should keep in mind in terms of their kids health?
So winters in general, because of the temperature, it is favorable for viruses. So they multiply much faster. There is some evidence that because if your nostrils and your respiratory passage are exposed to extreme cold and dry air, there could be a suppression of local immunity and so on. So Omicron, COVID, flu, they are all viruses, and the symptoms will be very similar. There could be minor variations. Like I said, if you had to suspect, like say in Delhi now, as of now, we have been having less than 50 cases, right? So your data in the hospitals, from the OPDs, from the emergencies, it will tell you that so many people or so many children are reporting with cold, cough, or fever or something, and you see a sudden surge. You suddenly see, last 3 days the number has gone up by fivefold or threefold, or there is a new symptom that's coming up. So those high alerts will be there under the circumstances, so that that the government is collecting data. There are different surveillance methods which are there, so that gets kind of picked up that something is changing, right? So to say that this is Omicron or this is seasonal flu or this is something else, it will be difficult. But viral and bacterial infections can generally be to a certain extent differentiated. So the doctors are able to do it. So if your child is, in general, for any patient, I would say, if the fever is very high grade, breathing is troubled, the hands and feet feel cold, the child is not able to sleep, not able to feed well. So those are dangerous signs in any situation, I would say. So if your child has cold and cough, please don't send them to school. And we say that even otherwise, when you're sending your child with a viral infection to a crèche or a play school or this thing, so other kids will get affected. So it may be COVID, it may be Omicron or any other virus, right? So those general precautions hold good irrespective of what the virus you are dealing with. Right. So I think that that's a general kind of statement that I would like to make. So it's not necessary that you label that this is Omicron and this is the other COVID or this is a seasonal flu. The most important thing is you take precautions. If your child is not well, please don't send him to school or play school or crèche, wherever, so that it doesn't become a source of spreading to others, whichever virus it is. And again, if a child is running fever, not feeling well, you need rest. You need proper temperature. You need warm fluids. So those things you can't really manage in a school setting or this thing. So it's much better that anybody who's unwell stays home, takes rest, stays well hydrated, takes adequate precautions.
Also कुछ कोई ऐसा diet में if they can follow something, parents के लिए कोई tips, because since it's winters they need the immunity to be strong, so कोई ऐसी tips जो खाने में, diet में they can follow?
So I think balanced diet remains the basic necessity. So again, winters, it's probably a good idea not to go for refrigerated drinks and stuff, so anything at room temperature. Then in our culture we have, things जो winter में हम बनाते हैं, पिनिया बनाते हैं, पंजीरी बनाते हैं, and the besan ka shiras and all those things, they can't do any harm. They are high calorie foods and they are soothing for your throat. So those are good things. तुलसी वाले जो काढ़ा बनाते हैं या वो सब चीजें हैं, I don't see any harm in doing those. So how much फायदा they do, it's difficult to quantify, but these are good things. Because in winter you to keep yourself warm, to maintain your body temperature, especially for elderly and for small kids, you need more calories. So these things are high calorie dense foods, the dry fruits, a bit of ghee in your khana, those are good things. Plus have lots of fruits, soups. Those are, again, they'll give you natural antioxidants, they'll give you natural vitamin C, they'll give you natural protection. So at the end of the day, your immune system needs a little bit of many nutrients. I mean, there's one way is that you go and pick up a pill or a syrup. The other is you have a balanced diet. So for a balanced diet, your plate should be very colorful. What I mean by colorful is like, you have say a pumpkin, which is yellow, you have a broccoli, which is green, you have a spinach thing, which is green, you have a dairy product, which is white. So it should be a rainbow colored plate that actually, I think, pretty much sums up that you get most of the stuff that you need.
That's a nice way to put it.
And this is not just for winter. That's not just for winter. It should be a general kind of thing. But in winter, we have a lot of traditional things, which are high in caloric density and they are good.
But ये तो हो गया डॉक्टर कि क्या खाना चाहिए, क्या फॉलो करना चाहिए, कुछ ऐसा जो नहीं करना चाहिए बिल्कुल भी. There are a lot of myths and misconceptions also at times which people don't really adhere to. तो कुछ ऐसा जो which is a complete big no, especially in the current situation and in winters.
So in the current situation, like we've talked about in the precautions, जो हम इतने 2 साल से सुना रहे हैं, you pick up the phone, it's के हाथ धोना है, 6 फुट का distance maintain करना है. अगर आपको sneeze करना है तो either you use a handkerchief or a tissue and you discard it properly, don't throw it on the road, or you use your elbow. If you want to sneeze or cough, so that it goes down, not on your hand, because that's like you can transfer it. This thing. Again, the crowds. We've been lucky so far that we've had last few months been good, but let's not, with Omicron lingering there, let's not push our luck too far. I think we should take precaution. We should get back to making sure that we are masked. We are not going for unnecessary socialization, or we form our own bubbles. it's been a very taxing period mentally for people, not being able to go out for elderly and all. So make sure that you are in a bubble where everybody is vaccinated. There's nobody who has symptoms of cold or cough. If you've traveled somewhere and you are having cold cough, isolate yourself within the family till you're clear that you're not carrying something which you can give to others. And they could be bubbles like small groups of 2 or 3 families where you can mingle in a restricted sort of way. So those are the precautions I think we should take. Especially small babies, elderly people, pregnant women, people with comorbidities, diabetics, overweight, or those who are on anti-cancer medications. These are the people who are at a much higher risk, right? So we need to protect them. So it has to be done with a lot of common sense, if I can say. It's not exactly science, but a lot of it is common sense.
And any last tip, yeah, any last, home based ritual, yeah, desi nuska jise kehte hai, that people can follow from the comfort of their home and yet, maybe boost their immunity or take care of their health, fitness, anything that you swear by or anything that you would like to recommend to people for all the viewers who are listening to us today?
It's difficult, that one thing, but I think from hygiene point of view, hand washing.
Hand washing.
It's probably one of the most important things, whether you are in a home setting or in a hospital setting or wherever. When you wash hands, whatever is sticking to your hands, like, if I'm carrying something on my hands and I pick up the phone, a community phone, or in my office, somebody else is going to touch that. If I use a doorknob, I've touched a handle, somebody else is going to follow me. So that is something which can this thing, but under the circumstances, I think it's even more important. It's not necessary to use these chemical based hand rubs all the time. Good hand washing a few times a day, especially before you eat. And if you come from outside, before you start touching things and here and there. So that will probably, if you're carrying anything in your hand, which is the most common way of spreading. And like I said, if you're sneezing or if you have any respiratory symptoms, please wear a mask, and sneezing and coughing has to be done in a very civilized way, if I can.
Especially
so
for
the kids will follow you. They see, like, my mom and dad, when they want to sneeze, they do this.
Yeah.
They'll automatically follow. You have to demonstrate it.
That's true.
You can't do yourself something different and kids will do something different. It doesn't work
That's
like
true.
that.
That's true.
Lead by example.
Yeah, so create good examples. Thank you so much, Doctor. I think this has been very insightful. Thank you for joining us today. The audiences will go back home with lots of valuable insights. So thank you for that.
Thank you. Thank you, Minnie. Have a good day and stay safe, everyone.
Yeah.
Bye-bye.
Bye-bye. Stay safe, stay healthy. Thank you, Doctor.